Assalamu alaikum. I'm Dr. Tamkeen Saleem. I welcome you for the lecture for week 15, and the topic is habit disorders, smoking and drinking behavior. You will be able to learn today what is alcoholism, what are the causes of drinking behavior, what are the consequences of drinking behavior, and what are the interventions available for alcoholism. The next habit disorder is alcoholism, which is the drinking behavior. Alcoholism is a complex behavior occurring in the context of an overall health lifestyle. It's an addiction to the consumption of alcohol drink, which may bring upon alcohol dependency. It is also known as alcohol use disorder. It's a condition in which a person has a desire or physical need to consume alcohol, even though it has a negative impact on their health or overall life. For many people, drinking alcohol is nothing more than a pleasant way to relax. People with alcohol use disorder, however, drink to access, endangering both themselves as well as others. Alcohol abuse is a drinking pattern that results in significant and recurrent adverse consequences. The abuser may fail to fulfill major responsibilities in academic, occupational, and familial functioning. They may have drinking related legal problems, such as they might have uh, been indulgent in a car accident because of intoxication and driving while being overdosed. They may have relationship problems because in drinking, the person is not having the clear thinking, and they may indulge in violent behaviors. People with alcoholism, technically known as alcohol dependents, have lost reliable control of their alcohol use. It doesn't matter what kind of alcohol is taken and how much is taken. Those who are alcohol dependent are unable to stop drinking once they start. It is characterized by tolerance, that is, to drink more and more to achieve the same level of highness. And withdrawal symptoms are present or experienced by the individual if the individual stops taking the alcohol, which may include nausea, sweating, restlessness, irritability, tremors, hallucinations, and convulsions. There are multiple causes of drinking behavior, but we can broadly classify them as genetic, psychological factors, and social factors. Not every individual is affected by each cause. However, we'll be discussing each of them. Genetic factors make some people especially vulnerable to alcohol dependence, which means that people have probably more risk for alcohol problems because of the family history of alcohol dependence. Makes a child or individual in the family automatically to grow in the same family environment and have same problems. So the it's the environment as well as it is the genetic factor which make an individual to go for drinking behavior. For some alcohol dependents, psychological traits such as impulsiveness, low self-esteem, or a need for approval from others prompt inappropriate drinking. Some individuals drink to cope up with their emotional problems. Similarly, there may be social factors or environmental factors like interaction with the peers who are alcoholics and ease of access in ease of access for alcohol. All these can play a vital role in development of the habit disorder of alcoholism. Poverty and physical or sexual abuse also increase the odds of developing the alcohol dependence. It is said that once people begin drinking excessively, the problem can perpetuate itself. Heavy drinking can cause physiological changes that make more drinking the only way to avoid discomfort. So, actually, it becomes their way of coping um with their discomfort and psychological and emotional problems. So, we see that this alcohol reinforces their behavior to get rid of stress and emotional problems. And other than that, they also drink because if they would not drink, it will bring upon withdrawal symptoms. So, in order to reduce or avoid the withdrawal symptoms, again, it is um, reinforcement mechanism that motivates them as well as that strengthens their behavior of alcoholism. Health consequences of drinking. It may lead to uh, hazardous health for the individual. The consequences may be divided into categories: the short term effect and long term effects. The short term effects may include memory loss, hangovers, and blackouts. However, the long term problems can bring upon severe problems like stomach ailments, health problem, cancer, brain damage, serious memory loss, or one of the most common one, that is liver cirrhosis. Heavy drinkers also markedly increase their chances of dying from automobile accidents, homicides, and suicides. Men are more likely to indulge in alcoholism as compared to women. However, women health suffers more in comparison to male, even if they take lower levels of alcohol consumption. In addition to the medical and physical ailments and problems, drinking problems also have negative impact on mental health. People may experience depression or anxiety. Alcohol problems don't just hurt the drinker, it is often the family members of the alcoholic who suffers. Spouse and children of heavy drinkers may face family violence. Children may suffer physical and sexual abuse and neglect and may develop psychological problems. Women who drink during the pregnancy, they have a very strong risk for damaging their fetus and abortion of the baby. Relatives, friends, and strangers can also be injured, or there may be some kind of accident or killing in alcohol related accidents and assaults. Smoking rates are increasing day by day, and there are more and more people who are taking up smoking habit. So, talking about health psychology intervention for smoking, there are two modes of intervention that are done. The one way to reduce smoking rate is to prevent people from starting or indulging in the behavior of smoking, for which we classify the programs as programs of deterrent, which means we try to deter people from taking up smoking behaviors. Such programs are often part of school programs, but to be effective, such programs must be extensive. They should be able to build student refusal skills and lead them towards commitment to refrain from smoking. One such program is called inoculation program. This inoculation program is basically designed to buffer the young adults from social pressures. That is, they are made learn how to refuse um, when they are offered to smoke by the peers, and how to show their commitment to refrain from smoking. So, what actually happens is there that uh, whenever there is social pressure, exposure to smoke, which may be a person, a peer group member, a friend, or the media, when they model the smoking behavior, these smoking behaviors are considered to be the infective agents. And when inoculation programs have been done, or people have been, or students or youngsters have been taught refusal skills, so that actually serve as that we have vaccinated a student or a youngster. So whenever there will be the infective agent of modeling of smoking behavior, they would be able to refuse because they have been vaccinated against that. So there is determined that will take place. Actually, this inoculation programs deals with the pathogen, that is the virus, rather than established disorder. So before a particular behavior sets in, we train the youngsters, adolescents, or the students not to take up smoking as a behavior. Many times, modeling behavior is also used in which the people are asked to view films of a person encountering smoking and then resisting social pressure to smoke. Similarly, regular health education programs are also conducted in the campuses, which show that how a person um, was pressurized by the peers or the media to smoke, but they did not take it up. There may be some kind of modeling shown between two people. One takes up smoking and other does not take up smoking. And then what are the health hazards or difficulties in life experienced by the person who took up smoking and who did not take up smoking. So they be able to learn from the modeling of the behavior. However, there are also community-wide anti-campaign smoking campaign. For example, last year in IUI, there was celebration of anti-smoking day, as well as there was a campaign in university that was led for anti-smoking, in which there were different kind of seminars that were set up by student advisor office, as well as there were some seminar programs that were conducted by Department of Psychology at female side as well as male side. For quitting smoking, most people who quit smoking, they carry that out on their own. Many times they indulge in a smoke cessation program, and sometimes they do not indulge in smoke cessation programs. However, when it is done, the relapse is a huge problem that is often observed in the smokers, because many times they are not taking the therapy, and without therapy it becomes difficult because there are withdrawal symptoms as well, and they do not know how to cope up with them. There are pharmacological interventions which are effective, which may be in form of nicotine replacement or drugs that influence the nicotine effects in the brain. These pharmacological treatments can be useful in the components um, in smoke cessation, but even more successful when combined with behavioral intervention. So what actually happens in the nicotine replacement programs, that there are other substances which are used other than the cigarette, which are actually providing the nicotine. Like for example, there are chewing gums which are available when the person chews, so the nicotine is provided to the person. Similarly, the usage of patches, nicotine patches are also there. The patch is worn by the individual, so the body does get the nicotine amount which is required by the body. Similarly, people are also switching to vapes, that is electronic cigarette. However, it is said that when chewing gums are used or when the patches are used, the behavior of cigarette smoking, that is not actually replaced. It's just nicotine that is replaced, and that is why many times people do not feel satisfied, even though the body is provided with the nicotine and the amount is available. Psychological interventions can also be effective in helping people quit, specifically when they are in early phases of smoking or quitting. There may be a number of strategies that may be utilized, for example, behavioral modification or CBT approach is also very much effective, which and there may be some kind of group therapy programs in which the person may get enrolled, and then because there are social support groups, so people are able to learn that how the others are dealing with their problems and how successive the other people are. Similarly, there are also contracts made by the smokers and therapists in which the smoker agrees to stop smoking. Then they may also be taught with the relaxation training because many people smoke under stress. Similarly, stress management programs may also, or stress management techniques can be taught. There may be booster sessions to prevent relapse as well as other uh, uh, techniques that may help individual to adjust with the relapse.